Okay, so my lovely client's come today to get some Botox and also some lip filler. So we're going to go over first, starting by lip filler, and go over the consultation with how we normally work with the patient. And if you've got any questions at any point, stop me. We'll go over it in detail if I'm not clear or you want to go into something a bit more in depth.
Yeah.
Okay. Okay, so what we're looking at here from this picture that you very kindly provided, okay, is how far your lips come out. Now, what Chapel Beauty specialises in is natural looking results.
Yep.
So if I told you I've got 8 ml of filler in my face and half of them in my lips, you wouldn't naturally know from looking at me.
No.
I look like I've gone on a long holiday. I don't look like I've got a lot of things done.
No.
So the trick is how to make something look natural to what you can naturally achieve naturally,
Yep.
with a little bit of a helping hand, and not look done.
Yep.
So we've got to try to, so when we start looking at certain things within the face, what we're looking at is lines and how artistically where they should be in natural proportion, if that makes sense.
Yep.
So what these two lines say is that realistically any lip should be in between this line.
Okay.
In between those two lines, sorry. Overfilled, underfilled. Okay, so you're with me. So we're basically looking from the peak of the nose to the peak of the chin, and the middle of the nose to the middle of the chin, roughly.
Yep.
Okay, so you're quite well in projection from what I can see. So I don't really think working in projection is going to work for you, mainly because if we look at where you currently are, you're bang on where you should be,
Yep.
And you're quite close to the line where we don't want to go over, because that's what starts to look from your side profile.
Yep.
It starts to look done. Okay, we're going to ignore that, and we're going to look at this one. So the thing that I can spot from yours, just from a front angle, is the bottom lip, your left,
Yep.
right, is a little bit less than the
Yes.
other side.
Yeah, when I put lipstick on, I have to overline this side to match with the other one. Yeah.
So I'd like to work on that one with you, just to bring that slightly in alignment if you're happy with that.
Yep.
And then I don't think we need to work so much on volume with you, but I want to work a little bit on the shape.
Yes.
So I'd like to work on the Cupid's bow a little bit to bring the arch up.
Yeah, that's what I was sort of looking for.
To set expectation,
Yeah.
you're not going to have a massive arch because your natural anatomy.
I don't want a massive one. I
Okay.
just want a little bit
Pronounced.
more. Yeah, because
Okay.
I do wear for work. I wear red lipstick.
Right.
So I just want them to look a little bit more
Shaped.
Yeah.
And then I've noticed that we've started to get some early signs of ageing. It's very early. Do you smoke by any chance or vape?
Yes.
Yes, so we can start to see some smokers' lines starting to form, which is repeated use. My advice would be, when using filler for at least 48 hours, don't vape, don't smoke. The
Yeah.
reason being because filler's moldable.
Yes.
We want that to get rid of all these things, so we're going to make some very small injections right on the vermilion border,
Okay.
to basically get rid of those for you. And then we're going to rely on our injections at these 2 points to let them fill the lips a little bit. Not fillers in terms of projection, but fill to give you that shape
Yeah.
and get rid of some of these lines.
Yeah, sounds good.
In terms of what you were expecting, are we hitting the mark for where
Yes,
your concerns were?
definitely.
Because obviously you told me a few of the concerns on message.
Yes.
So what I tend to do is take what your concerns are, send me some pictures, let's see what we can do,
Yeah.
and then let's work out a
Yeah,
plan.
no, that's definitely. I mean, as you can see from there, you can see that there's
A slight difference.
Yeah, and it irritates me because especially when I'm constantly having to reline my lips with work and stuff. It's just I just want that where it's boom done, and I
Yeah.
don't have to do that. And yeah, with the Cupid's bow, I'm not wanting a massive one,
Yeah.
like Rihanna. Just something a little
natural.
bit more. Yeah.
So your lips are very well, the bottom one in my opinion is a little bit less, so lips in Caucasians at least should be 1.6 to 1. Your top lip's always a little bit bigger, but your bottom one could do with a little, not massive, we're not talking about bringing it all the way down, but we do need to match up where we can, and then give you a little bit pronounced on the Cupid's bow. So what we do is we basically follow the column here, and that tells me roughly where your border, where your peak of the bow should be. So those are the injection techniques that we're going to be doing today. So we're going to be doing some linear threads, a C-shape injection where we basically put the needle in and then we flip up to try to get support as we can, and then a little bit of extra fanning just to give it some support, and it's not just relying on the C. Now, our risks with filler, you get something called a VO, which is vascular occlusion in English, and what that basically means is we've got these veins on the lips, okay, that feed the lips with oxygen and blood, okay. Now, locally, they'll be in the same area, but even the arteries and veins here will not be the same on you than what they are on me.
Yeah.
So even though locally we know where they are, sometimes we can hit an artery, okay? In that effect, if you can see there, the blood returns instantly, so it refills.
Yes.
So even on my lip right now, it refills with blood. So that's called an capillary refill, okay? If it wasn't to return, that'd indicate that there's a blockage somewhere.
Okay.
In that instance, you have an emergency number that you need to contact immediately when you see that, and I'll show you how to do an capillary refill here before you leave. You need to ring that number immediately. We come on site and we dissolve on site.
Okay.
If left untreated, it can cause something called necrosis, okay, which basically means the tissue starts to die because it's not being fed.
Okay.
Okay. So with these risks, we do need to talk about them and be really clear. They are possible,
Yep.
but as long as we can treat it immediately, it's fine.
Okay.
Okay, in all the time that I've been practicing, I've not caused one yet, but you do need to be aware of them, okay? I've treated more than what I've caused.
When I've had my lips done before, I have been told that there is an artery somewhere around here. I don't know where, but it was so because
it pulsates.
Yeah, so because I used to go to a clinic in Tamworth, ABA Models, so I used to model for them.
Yeah.
And the girl that was going to do it went straight, and the lady was like, "No, stop! There's an artery right there." So, but I just thought I'd let you know.
No,
just
absolutely.
you'll see it anyway, but just.
Perfect. Better to know than not. It just means that you've got a slightly superficial artery. That's all. So what we do is when we inject, it gets irritated, so it starts to pulsate more.
Okay.
So what they'll probably have seen is within the artery here, it'll start pulsating.
Okay.
The only thing that we'll do is we'll start on the opposite side, so then we can start seeing it pulsate properly, and then we're like, right, there's what we need to avoid. So overall, that's how the basic arteries are, the positioning and things like that, okay? You'll be given an emergency 24-hour number, whether it's 1 o'clock, 3 o'clock in the morning, it doesn't matter, you ring that number immediately. Okay. It'll present like a bruise with a white bit in the middle, that's very normal for vascular occlusion. If you press it and the blood doesn't return, you ring that number immediately, we don't wait about, you ring it immediately. We've got 8 hours to do it, but if we can catch it as soon as possible, better to treat it sooner rather than later.
Okay.
So those are the lips. We're going to move on to a slightly different topic. Have you got any other questions about this procedure that we're doing today? No. Okay. So the second treatment that we're doing today is anti-wrinkle injections. Okay, now anti-wrinkle injections come under basically paralysing the muscle or putting the muscle to sleep. Okay, now there are currently 7 brands in the UK that we can use that are licensed for us to use in aesthetical use. I tend to use 4: Botox, Bulkshore, Azalot, and Azalescence. Those are the 4 that I use. Today we're going to be using Bulkshore. The reason that someone would start with Bulkshore or Botox with me is because the spread of the toxin's reduced. Downside to that is the toxin's slightly bigger, so the allergen, the actual thing that's going to put the muscle to sleep, is slightly bigger, so it takes longer for the muscle to envelop it, essentially. What happens at that point is, so it will take 14 days roughly to kick in, but once we've got your facial mapped done, and we know where we're going to be injecting and how much, I'd then move you over to Azalot, which does kick in within, but I see in my clients, at least, it tends to kick in 4 or 5 days, which means you get that wear outfit. As long as you don't have any allergic reactions, there's no facial droppages, we've not hit somewhere where we're not meant to, anything like that, I'd then move you over to Azalescence, which can last for up to 6 months. So it's a more durable product, if you like. The areas where we'll be focused on, frontella, so these 2 lovely muscles here. And what we're basically doing is 3 to 4 injections on each side of each muscle, basically relax that muscle to stop you from being able to move it. We'll then be focused on corrugators and the glabella.
Oh, I definitely need that.
Yeah, honestly.
It's the mum scowl.
The mum scowl. So we're basically doing 1 injection there and maybe 1 or 2 there, depending on how strong the muscle is. And we're doing 3 areas today, aren't we?
Yes, please.
So we're also going to be looking at crow's feet as well. So we're going to be doing this particular muscle here. We're going to be doing 1, 2, and 3. And obviously we've got the 2-week review where we'll basically review the lips and the toxin together.
Sounds good.
Any questions or anything that you're worried about?
Nope.
No. Perfect. Right, guys, so what we're going to do is just clean the area a little bit, just where we're going to be injecting, as we don't want any nasty infections or anything like that. Really important that the client understands what's going to happen, so do explain to them step by step what's happening. I'm going to ask you to do some really funny expressions, lovely, I'm really sorry. So I'm going to ask you to raise your eyebrows as far as they'll go. Relax, again for me. Okay, so we're going to, don't inject anywhere in that area, but we do, most of the bulk of the muscle seems to be moving from that area. And then if you can do your angry mum face for me. We've got some quite strong corrugators that we're going to target. Relax, do it again for me, raise your eyebrows. Okay, we're going to be going for that muscle there. Amazing, relax now, lovely. I'm going to go on the other side. Raise your eyebrows again for me. Amazing. So we're just going to inject there, there, and there, avoiding this area. We don't want it. Maybe you could squint for me, lovely. Okay, you've not got a very big crow's feet, but we're still going to treat there. Amazing. Okay, if you just want to look over there for me, and you want to squint again for me, amazing. Let go. Amazing. So we're going to go there, there, and there. I'm going to put a little unit there as well. I'm going to try to do a little bit of a brow lift as well.
Oh, please, that'd be nice.
Amazing. Okay, lovely. So you want to lie down for me, get comfortable, if we can cut there. Hi guys, welcome to Chapel of Beauty. My name is Jake and today I am joined by my lovely Abby. Abby's come for her 2-week review today to see basically the end results and honest feedback so you guys can all see what it's like to work with us. So Abby, how have you been since treatment?
Been amazing. Absolutely love the results of what you've given me.
Yeah.
I just feel very refreshed. The
Amazing.
problems that I had have just feel like they've just completely disappeared. So yeah,
That's
really
brilliant.
happy.
And overall, so obviously I know you've been to other practitioners and you have changed in the past. If someone was to ask you what the main difference between us and other practitioners, because I know that there's thousands of practitioners now, what would you say the main difference is for you?
You're very honest about things. So like I said to you that I wanted 1 mil of filler and you was like, no, that's not going to happen. Which I really liked because you were honest. Your communication was really good from the moment I spoke to you about booking all the way through to the aftercare. Message checked up that I was okay. You were just completely different, very professional. You went through things differently with me than what the other practitioners had. Like you had photos of my face and you showed me what could work and what couldn't and things like that, whereas the other practitioners just got the needle and straight in. So
Wow.
yeah, you were a lot better.
No, I think that one thing that we have to do is make sure that our clients understand what's happening because it's not an easy thing to understand all the time. Don't forget we've trained for in some cases many years to be able to do what we can do. But sometimes translating that to clients is not always easy. So one thing that we try to do is make sure that obviously everyone knows exactly what's happening because it is quite a scary thing. Someone's coming at you with a needle, which I'm sure everyone's a bit like, oh my God, stay away from me.
Yes.
And then if someone asks for your advice, because obviously I know that when I want to get something done, the first thing that I'll do is go and ask my friends, my friends who are girls, my friends who are lads, and just say, listen, you've got this done, where did you go? What would be your feedback to someone who is asking you, would you go to Chapel Beauty?
Well, it would be 100% yeah. Like I see a lot of mums at school, which is one of the reasons why I wanted to have a little bit of work done because the mums are very glamorous. And I have one specific person that has come up to me and has asked who has done my Botox. She knew damn well that I'd had it done, and she was just like, "It's amazing. Where did you go?" And I recommended you straight away. I gave her your number and everything, and I'm hoping that she's going to book in with you. But yeah, I would recommend you to anybody. If someone said, "Have you had work done?" I'd be like, "Yes," and this is the guy that did it. So yeah.
Thank you. That's amazing. And then just to touch on the last episode, obviously you've had your tox done with us, and you've also had lip filler augmentation done with us.
Yes.
Would you say that we hit the goal that we were aiming for?
Yeah, definitely. I didn't want to be overfilled, like barely any movement in my face because I don't want people to be like, yeah, she's had the filler, she's had the Botox. I want to have that still natural look, but still feel that confidence, and that's what I do have.
Oh, amazing. I think that that's one of the gifts that we have during this role is we can give that confidence back to people and really build you back up. And that's one of the things that I do love about my job.
Yes.
So all I can say is thank you so much for coming today. Thank you for taking the time.
Right. Thank you for having me.
No, absolutely. And if you guys have any more questions or would like to know anything else about any of the procedures we've talked about today, please send us a DM and I'll do my best to answer as best as I can. Thank you very much.